Some cuts to Medicaid services could be coming soon to North Carolina. State lawmakers didn't fully fund Medicaid in that stopgap spending plan that they passed last week. WRAL's Capitol Bureau Chief Laura Leslie talked to the state health secretary about what the cuts could mean.
Every year, state health officials have to adjust the Medicaid budget to account for rising health care costs and any increase in the number of patients it serves. That's known as the Medicaid rebase, and it's usually part of the state budget. This year, Medicaid leaders said the rebase needed for the next fiscal year would be $800 million. But the spending plan supplies only $600 million. That's a cut of 25%. House Budget Chair Donnie Lambeth said lawmakers could decide to give Medicaid more money later.
Let's get them going. It's something that they need, better than nothing. We will have to look at some reform within the Medicaid program. We are looking at enrollment, we're looking at rates, and there'll be more to come on that as we get into the fall.
But Governor Josh Stein said lawmakers are failing people who depend on Medicaid.
It helps fund part of the rebase, but it does not fully fund it. And there are going to be real consequences on human life because of that failure.
We asked State Health Secretary Dev Sangvi what consequences will the cuts have, and can they be averted if more funding comes in later?
There are 3 million people, over 3 million people who rely on Medicaid services. And in many cases, it makes a difference between living well and in some cases, life and death.
Sangvi said some cuts to services are likely. That means if you're on Medicaid, some things may no longer be covered. They're working through different scenarios now to see how they can do the least damage. More money down the road would help, of course, but the sooner the better.
The longer you wait to know how much money you're going to have for the year, the harder it is to implement cuts later on.
Laura Leslie, WRAL News, Raleigh.
Now, House Speaker Destin Hall wasn't available for an interview, but his office did send out a statement, and it reads in part, "This fear-mongering is disingenuous and unproductive." While DHHS is claiming rapidly climbing costs, there's some disagreement on what the actual number will be in the end. The $600 million we allocated will provide a stopgap while we continue to evaluate federal impact and see what the next steps are.